Hello, everyone. Um, I am doing myofascial remodeling module case study. I have here my client who's having some groin pain. Prior um, to the video, everything was communicated to him, including the potential risk and benefits and some contraindications. We're gonna start from different assessments before we proceed to the treatments. So I'm gonna start with my postural assessment. So I'm gonna have my client to walk for me back and forth. So you can go ahead and walk for me. We are looking for any imbalances on his posture. And then I'm gonna watch also through the sides. Again, taking notes for any imbalances from top to bottom. Next, I'm gonna do a Stork test. So my thumb will locate the PSIS, my right thumb, and the next one is on the S2. And then I'm gonna have my client raise his right hip, and then on this manner we are looking for a inferior movement of the PSIS. Now I'm gonna move to the left hip. Again, my thumb on S2 and the other one was PSIS, left your hip now. Again, we're looking for the inferior movement of the PSIS. So far it's all normal. And then I'm gonna see if there's any change. If I'm gonna raise his or abduct both his arms to tighten that latissimus dorsi muscle. So again, raise again your hip and see if there's any changes. So far, then PSI is moving normally. Again, that's good. Next, I'm gonna do a CCP assessment. I'm gonna start with the AO or OA joint. So I'm gonna bring my client's neck into full flexion to lock the joint, and then I'm gonna rotate to the left, to the right, I mean, and then to the left, looking which way is easier. So in this case, I found the left one is moving easy. And then next, I'm gonna place my hand under his scapula. I'm gonna raise my right hand, turning that scapula to the left. And then I'm gonna left my left hand too. Again, taking note which one is easier. So he's got the right one is the easiest one. And then alternatively, I will check this chest area. Again, look for the easier range. Next is the pelvic diaphragm or the lumbosacral junction. Everything's good. Next is the pelvic diaphragm and sacral movement. With my soft hand, I'm gonna place both of my hand between his axial tuberosity and the sacrum. I'm gonna ask my clients to inhale and exhale, and then I'm gonna feel that movement towards my hand. And then I'm going to move my hand towards the top of the sacrum. Again, taking note of the normal nutation and counter nutation of the sacrum. So in his case, everything is normal. So for in his case, I'm gonna check on his quads and his adductor area, so the inner thigh. I'm gonna do a strain around the clock assessment. So what I'm gonna do is I'm gonna press the tissue, and then I'm gonna move superior, inferior, medial, lateral, and then add some rotational component. So by doing that one, I'm gonna be able to identify if I'm gonna do a direct and indirect during my treatment. So on this one, I'm gonna find the way of the movement that goes into bind. So for this movement, I find that going superior has the restriction or goes into bind, and going medially, and then the rotation, so that goes into bind. And then I'm gonna check also on his other leg, same thing as what I did, but in the video I'm gonna particularly doing this one since this is the leg that has the groin pain. For the treatment, I'm gonna start with the global technique. So I'm gonna place my left hand flat under his sacrum. Okay, you can put it back, and then my other hand on the pubis area. So in this position, I'm just gonna let his body move, or I'm gonna follow the movement of motility movement, and then for my local treatment, I'm gonna have my client do the sideline position, so exposing his affected adductor. I'm gonna look for a cord-like feeling tissue, and then I'm gonna lift and pull, lift and roll the pes anserin, and then using my fist, soft fist, I'm gonna go this way, going towards the ischial tuberosity, and then lift and roll again the pes anserin until I feel the tissue opening. And then for my focal technique, I'm gonna focus on the medial intermuscular septum. So I'm gonna do like a sliding factor towards the ischial tuberosity, or the upper side. So I'm gonna press the tissue, and then I'm gonna ask my client to flex and extend his knee. So go ahead, flex and extend your knee. I'm gonna keep on doing this, going up. So while it's doing an extension, I'm gonna contract until I reach the ischial tuberosity, and then stay there. And then now I'm gonna move anteriorly and move to any plane, and then I'm gonna try to patiently pull the tissue from its bony attachment. I'm gonna keep on doing this until I feel that the tissue over this area is starting to soften. And then now for my reassessment, I'm gonna have my client to do a supine position, and I'm gonna do a strain, or yeah, like a strain around the clock assessment on the affected leg or hip. I'm gonna press the tissue again very lightly, doing superior, inferior, medial, lateral. Again, taking note if there is any changes. Now I can feel that it's easier to move on different planes. Now I'm gonna ask my client, how do you feel, Jovito, with your groin pain? Do you feel any change? So my client feel a lot looser. So I guess that's the end of my video case study.